We've been reporting higher flu rates lately, and U.S. health officials say we are now experiencing a flu epidemic. Brandon Lewis from our National Verify team helps to put that all into perspective.
Cases of the flu are on the rise nationwide. The Centers for Disease Control and Prevention report flu activity is high or very high in at least 17 states, exceeding the agency's projection for this point in the season. When cases increase significantly above normal, the flu is considered an epidemic. On November 4th, Dr. Jose Romero, director of the National Center for Immunization and Respiratory Diseases, said the U.S. crossed the epidemic threshold for flu. Soon after making the statement, online searches showed an increase in people wondering if it's normal for flu to reach epidemic status. So let's verify. Our sources are the CDC, the World Health Organization, Columbia University Mailman School of Public Health, and health information website Verywell Health. The CDC, WHO, and public health agencies around the world use the moving epidemic method to determine if a country is experiencing a flu epidemic. Each week, health officials look at the number of flu-related deaths that we've seen at this point in the season during the past 5 years. That data is averaged together, creating a baseline. Then, they look at how many deaths we are seeing currently. If that number is significantly higher than expected, then it's considered an epidemic. The CDC also reviews this data on a state and city level and can declare a local epidemic. Since flu tends to peak at different times and places, our sources say it's actually common to experience an epidemic during some months and then see normal flu activity during others. So, yes, it is normal for flu seasons to reach epidemic status. During the pandemic, there were 2 years when we had significantly fewer cases than normal because of social distancing, masks, and other precautions that have since ended. This means our baseline to determine an epidemic is lower than it may have been had COVID-19 never hit. With your Verify, I'm Brandon Lewis.